My name is Alex Enriquez. I talk about COVID-19 case, acute core pulmonale in critical ill patients with COVID-19. Definition: Coronavirus are important human and animal pathogens. At the end of 2019, a novel coronavirus was identified as the cause of a cluster of pneumonia cases in Wuhan. In February 2020, the World Health Organization designated the disease COVID-19, which stands for Coronavirus Disease 2019. The virus that causes COVID-19 is designated Severe Acute Respiratory Syndrome, Coronavirus 2. Previously, it was referred to as 2019 nCoV. Pulmonale is a condition that causes failure of the right side of heart, prolonged high blood pressure in the pulmonary arteries and in the right ventricle of the heart can cause pulmonale.
What is a novel coronavirus? A novel coronavirus is a new coronavirus that has not been previously identified. Coronavirus is an enveloped single-stranded RNA virus. Viruses cannot reproduce on their own. They must invade a cell, take over the cell's internal machinery to build the parts needed by the virus. Recent updates show that the novel coronavirus is 70% similar to SARS, or Severe Acute Respiratory Syndrome Associated Coronavirus Disease, that appeared in 2002 in China. It spread worldwide within a few months, via droplets that enter the air when someone with the disease coughs, sneezes, or talks. How long can a virus live outside the body? Cold and flu virus-laden droplets may remain infectious for several hours depending on where they fall. Viruses generally remain active longer on stainless steel, plastic, and similar hard surfaces than on fabric and other soft surfaces. Other factors such as the amount of virus deposited in a surface and the temperature and humidity of the environment also determine how long viruses stay active outside the body. It is possible to catch the infection after handling an object an infected person sneezed or coughed on a few moments ago. But personal contact with an infected person, such as a handshake or breathing in droplets from a cough or sneeze, is the most common way these viruses spread. What are the symptoms and complications that novel coronavirus 2019 can cause? Symptoms reported include mild to severe respiratory illness. This usually only lasts for a short amount of time. Symptoms may include runny nose, headache, cough, sore throat, and fever. You can also have a general feeling of being unwell. Some coronaviruses can sometimes cause pneumonia or bronchitis with difficulty breathing. This is more common in people with cardiopulmonary disease, people with weakened immune system, infants, and elderly people. MERS symptoms usually include fever, cough, and shortness of breath, which often progress to pneumonia. About 3 or 4 out of every 10 patients reported with MERS have died. MERS cases continue to occur primarily in the Arabian Peninsula. SARS symptoms often included fever, chills, and body aches, which usually progress to pneumonia. No human cases of SARS have been reported anywhere in the world since 2004. Thank you for listening.
Application in medicine. We describe five patients in our intensive care unit who had confirmed COVID-19. All five patients presented to the intensive care unit between March 2023 and April 4, 2020. 4 of the 5 patients had profound hemodynamic instability and cardiac arrest with acute right ventricular failure, and one had severe hemodynamic instability without cardiac arrest. The clinical scenario and echocardiographic findings in one representative patient are provided.
COVID-19 is a new infectious disease. Early on, it seemed that the main symptoms were fever, cough, shortness of breath, and that's really what we were looking for. As we gained more experience with this infectious disease, we learned that sometimes it can cause nausea and vomiting, diarrhea, stomach pain, a loss of taste or a loss of smell. It can be subtle, and some people don't really have symptoms at all. So as we understand that, we are expanding our criteria for testing. We still have a lot of cases of COVID in our community, so we are not out of the woods. If you don't need to go out, I recommend that you continue your social distancing, particularly if you're an at-risk group. People with diabetes, heart and lung conditions, obesity, they really are at high risk, and I would encourage the continued social distancing that they've been doing.
Pros and cons. Pros. The one patient's condition improved with thrombolytic therapy at the time of hemodynamic instability. One patient was receiving therapeutic anticoagulation with intravenous heparin according to a non-critical based anticoagulation protocol, and the remaining patients were receiving prophylactic anticoagulation. Cons. Over a 48-hour period, the 5 patients who were admitted to UCU within our hospital system had profound hemodynamic instability due to the development of acute pulmonale, cardiac arrest with pulses electric activity occurring in 4 patients, and 3 of these patients had died as of May 1. In 1 patient, acute pulmonale developed without cardiac arrest.
Hello, so today we'll discuss the treatment of cor pulmonale. Cor pulmonale, as we said in another video, is when we have, as the name suggests, a heart disease due to a lung disease. Cor means heart, pulmonale, lung. The lung is causing a heart disease. Why? Because, for example, the pressure builds up in the lung and therefore the right ventricle gets exhausted because it cannot pump the blood to the lung. Because the right ventricle's function is to pump blood to the lung. And if the pressure is too high, because we have COPD, for example, a chronic obstructive pulmonary disease, then this lung does not function. The arteries get high pressure and the right ventricle is totally exhausted. We get heart failure and the patient can die. Okay, so what is the treatment now? This video will be ridiculously short. And why is that? Because the treatment is actually treating the cause of the cor pulmonale and not cor pulmonale as a disease itself. Cor pulmonale is actually a consequence of another disease. So if we have COPD as the cause, then we treat COPD. If we have pulmonary embolism as a cause, then we treat pulmonary embolism. If we have primary pulmonary hypertension, then we treat hypertension, the pulmonary hypertension, and so on. If we have systemic sclerosis, so please check the video which I dealt with in another video, which are dealing with the causes of cor pulmonale, and then think of these diseases and what the treatment can be. So cor pulmonale, as in one sentence, can be said: we will treat the cause and then we treated cor pulmonale. That's it. And if, for example, if the cor pulmonale is causing hypertension, heart failure, then we treat heart failure. So you get the point. But the most important you have to remember in this presentation is that cor pulmonale is treating the cause of the cor pulmonale, and the most important causes are COPD and the acute that is the most common chronic cause, and the most common acute cause is pulmonary embolism. So please go to these videos and check the treatment of these two diseases, COPD and pulmonary embolism. I thank you very much for listening.
Issue applied in Ecuador. It's reported that 58% of patients with a diagnosis for cor pulmonale present by envelope the 74 years. What also stands out is that the age group with the highest risk of presenting these pathologies are those between 63 and 95 years, without neglecting those patients between 85 to 95 years of age, the same ones that represent a higher risk of having a poor prognosis. Regarding sex, the high incidence in women of around 67.5% is shown in relation to the male sex and represent 32.5%.
Hi, I'm Dr. David Winter with Baylor Scott and White Health, here to talk about what you can do to treat the symptoms of coronavirus. Fortunately, most people have mild cases of coronavirus, and for that you can take medicines you can obtain without a prescription at the pharmacy. So head congestion, antihistamines, decongestants, those work well. Some people use nasal sprays, those can also help clear up the nasal passageways. Muscle aches and pains, acetaminophen can help. There's cough medicine available. Mucinex DM is one, Robitussin. Many of those are available without a prescription. And then you want to get plenty of rest and drink lots of liquids. That's common advice for any virus, also works for coronavirus, unless you get to the severe stage. So indeed, if you have significant shortness of breath, marked fatigue, confusion, seek medical attention. Please stay safe.
Conclusion: myocardial dysfunction and hypercoagulability have been reported in patients with COVID-19. However, the true incidence and clinical implications of these events remain unclear. Although acute pulmonary thromboembolism was the most likely cause of right ventricular failure in these patients, this was not definitively confirmed in all cases. Acute pulmonale causative obstructive shock should be included in the different diagnoses in critical ill patients with COVID-19.
The video starts by kind of going through the bones melting away, and then kind of taking you around the chest on the outside. Anything in yellow that you're seeing is COVID infected, destroyed lung tissue. What struck me, almost right away, and for somebody, especially for someone who's been in practice for almost 20 years, is just kind of the extent of the lung damage. So, in the past, this has been compared to, your garden variety pneumonia. It's been compared to the seasonal flu. And one of the things we need to get across, and we try harder and harder every day, is that this is nothing like the seasonal flu. This is not like your typical pneumonia. A typical, let's say, bacterial pneumonia would typically affect, one part of the lung, perhaps, one lobe of the lung. And again, as you can see in the video, it not only affects both lungs, but affects various parts of each lung. So it's pretty diffuse damage. And the other thing, the caveat in all of this too, is that the images that you were looking at, the video that you're looking at, is based on the CAT scan that was performed before he got so sick that he had to be intubated and placed on the ventilator. So if you were to repeat that CAT scan perhaps 48 hours later, chances are you're going to be seeing much more yellow than you actually are, that things would be even worse. About halfway through the video, we do what's called a virtual bronchoscopy, where now you kind of get the bird's eye view and you start going into the trachea, into the major airway, and then you go down into the right lung. And now that you're actually inside the right lung, you're kind of seeing some of those yellow areas, up close and personal. This was a 59-year-old gentleman who did not have, you hear a lot about, this only affects elderly patients, or somebody who's got lots of other medical problems, or is immunosuppressed. And the more and more we learn about, our experience here in the U.S., the more we know that that's not true. We know that, the elderly, immunosuppressed, patients with a lot of medical problems are more severely affected, but the disease is not limited to them.
Thanks.